You know, surgery is one of the true marvels of modern medicine. It can fix things we once thought were unfixable, extend our lives, and improve them in ways that are just incredible. But with every single procedure, there's this unseen risk, a hidden challenge that happens at a level we can't even see.
And that brings us to the big question, right? What happens when this perfectly sterile, controlled environment of an operating room collides with the chaotic, microscopic world of bacteria? It's this constant tug of war. And the answer to that question, well, it's one of the biggest challenges in all of surgery.
The answer is something called a surgical site infection, or SSI for short. And believe me, this isn't some minor inconvenience. We're talking about the second most common complication a person can face after surgery. It's like this perfect storm of three things happening at once. Bacteria sneak into the surgical wound, the environment inside that wound gets all out of whack, and the body's own defenses are down because of the stress of the operation.
So to really get a handle on this, we're going to break it all down. We'll start with where these nasty bugs even come from, then we'll dive right into the wound itself, to what I like to call the wound battlefield. We'll look at how doctors figure out the risk, how they classify these infections, and most importantly, we'll go through the playbook for preventing them and fighting back when they do happen.
Okay, so first things first. If an operating room is supposed to be this super sterile place, where in the world are these bacteria coming from? The answer is, well, it's probably not what you're thinking.
Yeah, you'd think the biggest danger comes from a contaminated tool or something, right? But nope. The number one source of these infections is actually the patient's own body. That's right. The bacteria living harmlessly on our skin can suddenly become a huge problem when that skin barrier is broken. Now, of course, the threat is also external. You've got the general hospital environment, the air in the OR, and even the surgical team themselves, despite all their crazy precautions.
All right, so we know where the invaders can come from. Now let's get to the front lines. The second an incision is made and bacteria find a way in, this incredible high-stakes battle kicks off right there inside the wound.
And in this battle, there's a very famous villain. Meet Staphylococcus aureus, or just Staph. This little guy is the number one culprit behind most SSIs. And the wild part is, a lot of us are carrying it around on our skin right now, and it's totally fine, until it gets somewhere it shouldn't be.
The moment your body senses this intruder, it sounds the alarm. Instantly. The cut itself kicks off this chain reaction, and then the body launches its counterattack. The blood vessels nearby actually widen to flood the area with blood. This brings in the reinforcements, an amazing cleanup crew of cells called phagocytes. Their one and only job is to hunt down and gobble up those invading bacteria. It's an absolutely immediate and powerful response.
Now, this is where the battle can go one of two ways. If your body's defenses went out, the contamination is controlled. New cells arrive and the healing process starts. But if the bacteria start to overwhelm your defenses, it's a totally different story. The body's response goes into overdrive, and you get pus, tissue damage, and all those classic signs of infection we all know and hate: redness, pain, heat, and swelling.
Now, since this battle can swing either way, medical teams don't just sit back and hope for the best. No way. They have some really clever systems for predicting a patient's risk of infection before the surgery even gets started. One of the main tools they use is this thing called the NNIS Risk Index. It's actually pretty simple. You get a point for each major risk factor. Is the operation itself considered dirty, meaning it's in an area with a lot of bacteria? Does the patient have other major health issues? And is the surgery going to take a really long time? The more points you have, the higher your risk.
And that second factor, the ASA score, is just a quick way of grading a patient's overall health. A Class 1 is a totally healthy person. But as you go up the scale to Class 4 or V, you're talking about someone with very severe, life-threatening health problems. It's a really useful shorthand for surgeons to know how strong a patient's own defenses are likely to be.
Okay, but let's say an infection does happen. Well, the next step is figuring out exactly what kind of infection it is, because it's absolutely true that not all infections are created equal. The first way they're classified is by how deep they go. A superficial infection is just on the skin level. If it gets down into the muscle and the tissues underneath, that's a deep infection. And the most serious of all is an organ space infection, where it's actually affecting the organs that were operated on.
On top of depth, the timing also matters a lot. An early infection pops up within the first month, but some of these things can be sneaky, only showing up months after the surgery. Knowing this timeline gives doctors big clues about what might have caused it and how to treat it.
So, knowing the risks and how to classify the problem, how do medical teams actually fight back? This is where we get to the good stuff, the prevention playbook. It's this whole multi-layered strategy designed to keep every single patient safe.
And this defense starts way before anyone even picks up a scalpel. The patient's skin is scrubbed with powerful antiseptics that can wipe out 80% of the bacteria. If you have any other infection anywhere in your body, they'll treat that first. They even try to avoid having you stay in the hospital too long before surgery, just to limit your exposure to germs. And get this, if your surgeon has so much as an open cut on their hand, the whole procedure might get postponed.
Now here's a super interesting detail from that playbook. You would think shaving the area clean would be the best thing to do, right? Well, look at the data. Shaving actually creates tiny little nicks in the skin where bacteria love to hide, and it leads to a much higher infection rate than just clipping the hair or even just leaving it alone. It's a perfect example of how medicine is driven by evidence, not just assumption.
And once you're in the OR, the level of discipline is just immense. Of course, everything is sterile, but it goes so much deeper than that. It's about the surgeon's technique, handling tissues gently, stopping every little bit of bleeding, and closing the wound perfectly so there's no empty space for fluid to build up. That's what the real art is.
But look, even with the best playbook in the world, with the most skilled surgeon, infections can still happen. So, what's the plan then? How do you fight back against an active SSI? Well, the response is a very clear step-by-step protocol. First, and this is non-negotiable, the wound has to be totally cleaned out. All the infected stuff has to go. Then they'll often remove the stitches to let everything drain out. They take a sample of that fluid and send it to the lab to figure out exactly what bug they're fighting so they can pick the perfect antibiotic. And only when the wound looks clean and healthy again do they start the process of closing it up for good.
And that brings us to maybe the most important takeaway of this whole thing, captured perfectly in this quote: "Proper techniques and wound microenvironment are more important than antibiotics." Think about that. As powerful as our drugs are, they're not the most important thing. Prevention is everything. The skill and care that go into the surgery itself are the ultimate defense.
So that leaves us with one final thought. We have come so far in understanding, preventing, and treating these infections. The science is solid, the protocols are smart. But that battle between the surgeon and the microbe, it's still going on every single day. And it makes you wonder, doesn't it? With everything we know, will we ever see a future where the risk of infection after surgery is 0?